It's common when folks come to Caring Medical that they've already had physical therapy, often they've already had surgery, they've had massage therapy, acupuncture, and one of the common questions is, why didn't it work? You know, some people it works, other people it didn't work. What I like to do in the office is actually give the analogy of cabinet doors, and we all have cabinet doors, you know, that are hitting. Like you could see that, you know, this cabinet door right here is hitting. You know, this one actually is not. You know, these cabinet doors aren't hitting, and these cabinet doors are completely normal. And the difference is this cabinet door, you could see that one of the screws has started to get loose, but the hinge isn't very loose yet. And this cabinet door, the hinge is very, very loose to the point where, you know, it's making a mess and it's starting to wear out the wood right here. So the only treatment for this loose hinge right here is a Phillips screwdriver. You know, it's not a hammer, it's not a wrench. And another treatment that wouldn't make sense for this is for me to paint this, you know, to get rid of the scratches here. Like that doesn't make any sense because it's just going to get all scratched up again. So when somebody has chronic pain that is from joint instability, and you know it's from joint instability when your knee's hurting and you can feel a cracking, grinding, clicking sound. And also on physical exam, you can see that there's too much motion, or you can feel clicking, grinding, popping in the shoulder, for instance. So just like here, see how it's making noises? Adjacent bones, two bones that are held together by ligaments, are not supposed to hit each other. So if somebody has pain that's from the ligaments being injured, and the ligaments are what hold the bones together, so there would be ligaments that are holding this bone together, ligaments that are holding this bone together so they can glide good together. If a ligament is injured, much like if a screw is loose, you have to get a Phillips screwdriver. A hammer is not going to work, a wrench isn't going to work. So if you have a loose ligament, yeah, acupuncture may give you a little bit of pain relief, or physical therapy or massage therapy or surgery, but it's not going to cure the problem. If you want to cure the problem, you have to get those ligaments repaired, the ligaments strengthened, the ligaments tightened, and the treatment that does that is prolotherapy. When the ligaments are tight and the joint is stable, as represented by this, you know, it's gliding really good, all of the hinges are working properly, then there's no reason for the body to swell the joint because the joint's stable. There's not going to be muscle spasms in the back or the neck to try to stabilize the vertebrae there because the ligaments are tight. And there's not going to be any need for a bone spur to form, which would stabilize the joint. So if you've had physical therapy, massage therapy, acupuncture, even surgery, and it hasn't worked, it probably hasn't worked because you have an underlying joint that's loose, and the treatment for that is prolotherapy.